Okay, Dr. RJB, and I wanted to talk a little bit about fracture. Um, there are injuries in which a bone is broken, a fracture occurs basically. And Depending on the severity of that injury, um, uh, is how that fractured bone is going to be treated. If there's a severe fracture, sometimes the bone can be exposed, and this would be considered a compound fracture, where there's a break in the skin, and like I said, the bone is exposed. If this occurs almost always, the person is going to need surgery to repair the defect and to repair the bone. Because with this type of injury, there's a possibility of nerve injury, and because of the damage to the muscles and skin, this all has to be repaired. So usually this is done by surgery whenever there is a fracture that causes the bone to be exposed. There's also a risk with this of infection because the bone is exposed to the outside air and to bacteria. Um, um, uh, so usually this is a situation where somebody may need to be put on antibiotics to treat this. Um, if everything is still enclosed, it's more of a simple fracture. Um, and these are the fractures that can be reduced by the orthopedist using the x-rays to determine if everything is aligned properly. And Then a cast can be put on to keep the bones in the proper position so that healing can occur. There is a type of fracture called a Salter fracture, which involves a fracture in the area of the joint. And these fractures are especially concerning if this is a child who's still growing, um, because the Salter fracture frequently involves the growth plate. The bones grow at the ends, basically, so that's in the area of the joint. So the Salter fractures can involve the growth plate, which would mean that there might be some reduction in the growth of that bone, um, uh, and leaving the child with a extremity that doesn't grow as long as it should be during adolescence. Um, these are, again, a more complicated type of fracture. And Again, sometimes may require um, uh, uh, surgery or follow up by the orthopedist to ensure that that fracture heals properly. Um, the, um, uh, the usual simple fracture where it's the middle of the bone that is broken, again, put the cast on. And in general, any kind of healing that must occur takes approximately a couple of months. I've mentioned in a previous video that anything that the body has to heal takes approximately 2 months. And this is because there needs to be the lay down of proteins and healing to occur. And the final strength of that healing takes approximately about 2 months. This is something that's known. So uh, uh, the cast will be put on. And Sometimes what happens is that after a period of time, the cast will be removed, another x-ray taken to see how the healing is going on, make sure the bone is still in the proper alignment, and then another cast will be reapplied um, until the final healing occurs. And at that point, the cast can be taken off and person can go through any rehab that might be necessary or can return to the usual activities without a cast. If you do have a fracture yourself, this is probably what's going to be happening. Now, there are situations where the fracture does not heal properly. Sometimes in those cases, the orthopedist might have to do surgery again to use something like a pin or a plate for the fracture to hold it in place until the healing occurs. Um, uh, Usually this is a situation where there has not been complete healing at that site. And there's some concern that this fracture may fail with final healing. Um, I remember there was a situation that was like this. In a pitcher, he had a fracture of his arm, and after healing occurred, he threw the pitch, which refractured his arm. And so he was pulled from the game and once again returned to the orthopedist. Um, so these things can occur, and that's why it's important to get treatment as soon as possible after a fracture, get into a cast. These days, usually somebody goes to the emergency room and they are put in some sort of a splint immediately to hold the fracture into a good position until they can see the orthopedist. And usually that occurs fairly rapidly, and care is taken care of fairly fast. Okay, so this is just some information about fracture.